Assalamualaikum, I bid to my lecturer, Dr. Dila Shadia binti Abdul Latif. Today, my group and I will be presenting about our infography. The topic that we choose is pregnancy, childbirth and puerperium. Before that, let me introduce myself first. My name is Nurhana binti Muhammad Hamdan. First thing first, I will explain about the definitions of the puerperium. Puerperium refers to the following delivery which pregnancy-induced anatomically and physiologically alteration in mothers referred to the pregnancy levels. A 6-week puerperium can be split into 3 stages. The first one is immediate, that represent within 24 hours. Second, early, which represent up to 7 days, and lastly, remote, which represent up to 6 weeks. Code range for the chapter is starting from 000 until 09A. Next, I will explain about the code block for the chapter. As we mentioned before, the code range started from 000 to 09A. First code is 000 to 008 are represent the pregnancy with abortive outcomes, and 009 are focusing on supervision of high-risk pregnancy. Next, 010 to 016 are representing the edema, proteinuria and hypertensive disorder in pregnancy, childbirth and puerperium. Meanwhile, 020 to 029 focusing on other maternal disorder predominantly related to pregnancy. Plus, 030 to 048 are focusing on maternal care related to fetus and amniotic cavity and possible delivery problems. Continue to 060 to 077 is for complications of labor and delivery. Next, 080 to 082 is for encounter for delivery. 085 to 092 is for the complications predominantly related to the puerperium. Last but not least, 094 until 09A is for the other obstetric condition not elsewhere classified. So that, I'm going to explain about the guidelines for this chapter. The first one is general rules for obstetric cases. First thing first, all cases related to obstetric will be assigned from code from chapter 15 as a PD, followed by the other codes from other chapter for further specified condition. Next, chapter 15 codes only used for maternal record. The third one, the final characters for trimester will be used based on the provided documentation during admission and only be used for pre-existing and current condition. Next, the selection for trimester for inpatient admission that encompass more than one trimester are used when there is a changes of the trimester during the admission and the stay in the hospital. For unspecified trimester, each category that includes for trimester has a code for unspecified trimester. However, this code should not be used frequently. To identify all complications that suit the fetus, the 7 characters should be assigned. Plus, the character 0 used when insufficient documentation such as single gestation, insufficient to determine the fetus affected. Moreover, for fetal condition affecting management of mother, assign code from category 035 that represent maternal care for known or suspected fetal abnormalities and damages, and code from category 036 for maternal care for other fetal problems. During pregnancy, childbirth and puerperium, a patient who admitted because of HIV should be assigned code from subcategory 098.7- that represent HIV complicating pregnancy, childbirth and puerperium as a PD, followed by the other codes for HIV-related illness. Patient with asymptomatic HIV that admit to the hospital should assign code of 098.7 and Z21.
My name is Sarazila binti Muhammad Asmi. For the pre-existing conditions versus conditions due to pregnancy, there should be a differentiation whether the conditions that existed in the mother comes from her before her pregnancy or during her pregnancy. Assign codes from category 035 and 036 only when the fetal condition is actually responsible for modifying the management of the mother. Use code from category 035 for maternal care for non or suspected fetal abnormality and damage. For example, the fetals might have structural abnormalities such as heart defects for in-utero surgery. Diabetes mellitus in pregnancy. The PD will be the category 024 specific on EM or GDM on an inward trimester, while the ST is for diabetes code that comes from the codes E08 until E13. Selections of OB principal or first listed diagnosis. For the routine outpatients prenatal visits without any complications, the PD should become from subcategory Z34. Supervisions of high-risk pregnancy like ectopic pregnancy, the PD will come from the code subcategory 009. For visits when non-delivery occurs, the PD will be the primary cause that necessitates the encounter for delivery, while for when delivery occurs, the PD will be the cause of prompt admissions that is most related to admissions, and the ST will be the other complications of delivery. Code Z34 is used for the outcome of delivery. Postpartum period is immediately after delivery until 6 weeks after, while the peripartum period is the last months of pregnancy until 5 months postpartum. Any pregnancy related to complications after 6 weeks period, it can be used if documentation provided is related. For the code Z39.0, it should be used when delivery occurs outside the hospital before the admissions and there is no complications upon after that. For the pregnancy associated with cardiomyopathy, in the peripartum or postpartum cardiomyopathy, code 090.3 should be used. Code from subcategory 09A.2 should be used as a PD for poisoning, toxic effects, adverse effects, and underdosing in a pregnant woman, and the ST should be the codes that specifies the conditions caused by the poisoning, toxic effects, or underdosing.
Hi, my name is Nur Fatina Jiah binti Nordin. Next, I will continue with pre-existing hypertension in pregnancy. When assigning one of the old 10 codes that include hypertensive heart disease and also chronic kidney disease, add secondary code from appropriate category to specify the type of the heart failure and also the chronic kidney disease. Let's move to the gestational induced pregnancy diabetes. Assign code from subcategory 024.4. For patients that have been treated with insulin and diet, use code for insulin control. Next, assign code from subcategory 099.81 for patients that had abnormal glucose tolerance in pregnancy. You should remember that code Z79.4 and also Z79.84 should not be used together with the code from subcategory 024.4. For normal delivery, code 018 is used to account for full-term uncomplicated of delivery. Next is uncomplicated delivery with resolved antepartum complication. It means that code 018 can be used for the patient that had complication during pregnancy but the complication did not present when she was admitted for delivery. The outcome of delivery code that are appropriate with the use of 018 is Z37.0, which is single live birth. Okay, next is abuse in a pregnant patient. For the principal diagnosis for this condition, code from subcategory 09A.3, 09A.4 and also 09A.5 should be coded. Any appropriate codes that describe or identify the current injury related to the abuse should be coded as the secondary diagnosis. Last from me is termination of pregnancy and spontaneous abortion. Use code Z33.2 and code from category Z37 for abortion with live-born fetus. Next, for rating product of conception following an abortion, use code 003.4 and 007.4. For complication leading to the abortion, use code from category 004, 007 and 008.
My name is Mimi Shazana binti Yusof. For the next guideline is sepsis and septic shock complicating abortion, pregnancy, childbirth and Epiphanium. The principal diagnosis should be the complication or obstetrical code, and a code for the specific type of infection should be assigned as an additional code. If it is severe sepsis, a code from subcategory R65.2 and code for associated organ dysfunction should be assigned as additional codes. Next, for puerperium sepsis, code 085 should be the principal diagnosis, and the secondary diagnosis is code from category B95 until B96 to identify infectious agent, and if applicable, use additional codes to identify severe sepsis R65.2- and any associated acute organ dysfunction. A code from category A40 or A41 should not be used for puerperium sepsis. The next one is alcohol, tobacco, and drug use during pregnancy, childbirth, and the puerperium. For alcohol use, codes under subcategory O99.31 should be assigned as principal diagnosis. A code from category F10 should be assigned as secondary diagnosis to identify manifestation of the alcohol use. For tobacco use, codes under subcategory O99.33 should be assigned as principal diagnosis. A code from category F17 should be assigned as secondary diagnosis to identify the type of nicotine dependence. For drug use, codes under subcategory O99.32 should be assigned as principal diagnosis. This can involve illegal drugs or inappropriate use or abuse of prescription drugs. Codes from category F11 until F16 and F18 until F19 should also be assigned as secondary diagnosis to identify manifestation of the drug use. Next, for sequelae of complication of pregnancy, childbirth, and the puerperium, use code 094 and to be sequenced following the code describing the sequelae of the complication. The code may be used at any time after the initial postpartum period. The last one is COVID-19 infection in pregnancy, childbirth and the puerperium. If COVID-19 is the reason for admission, use code 098.5- as principal diagnosis and code U07.1 and the appropriate codes for associated manifestation should be assigned as secondary diagnosis. If the reason for admission is unrelated to COVID-19, but the patient tests positive for COVID-19 during the admission, the appropriate code for the reason for admission should be sequenced as the principal diagnosis, and codes 098.5- and U07.1 as well as the appropriate codes for associated COVID-19 manifestation should be assigned as secondary diagnosis. That is all from our group. Thank you.